The prevalence of asthma has increased significantly over the last 10 to 20 years, and it's unclear why that has happened completely. One idea is that we now live in a very clean environment. It's called the hygiene hypothesis. So we live in an environment where there is less exposure to infections, more antibiotic use. We've recently published a paper which showed that early exposure to antibiotics in children increases their risk of asthma. Historically, asthma has been considered a more urban disease, so people in the rural environment. So classically in South Africa, for example, people who move from a rural environment to Cape Town, their rates of asthma increase significantly. So this problem is not a simple, straightforward one. It's unlikely there's one single cause. It's likely that there's multiple causes. I think the biggest change in asthma management has been asthma education and the realization that asthma is a chronic disease. In talking to a patient, they'll often come to see me after they've been in the emergency room or they've been hospitalized for acute asthma. And in those settings, the patients are considering the acute event. The management of asthma is much more a chronic management strategy. So it's important to tell patients that they have to continue to take their medication even when they're well. The other one from a scientific point of view is the recognition that asthma is an inflammatory disease. The airways become inflamed, and unless one uses a prophylactic medication, the analogy I give to people is it's like taking aspirin for a toothache. If you take a blue puffer, it gives you some relief, but it doesn't get rid of the cavity. So if you take a blue puffer for your asthma, the symptoms are better, but you still have the inflammation, you still have the swelling in the airway. So it's really important to get that idea over to patients that the quick reliever medication may be very impressive in terms of improving the symptoms, but it doesn't really take care of the underlying problem. I think that's the most fundamental and important principle that patients need to learn. What I try to teach my asthma patients is that they have ownership and responsibility to take control of their asthma. We have very effective therapies. They have to make sure that their family physician shows them how to use their inhaler devices. They have to know what to do if their asthma gets worse. They need a written action plan. They need to have measurements of their lung function so that they know that their asthma is well controlled or not well controlled, and if it's not well controlled, is it because there's an ongoing environmental issue at home with mold or damp, or whether there's an issue at work. It's very important to advise asthma patients to stop smoking. So it's a multifaceted approach that has to be repeated, and patients have to be given the opportunity to learn lots about their asthma. Physicians are generally very busy when they're talking to patients, so it's very important and very useful for asthma patients to see an educator. The huge problem is that patients are prescribed very expensive and effective inhaler devices, but nobody ever actually comes and shows a patient how to use an inhaler device. And we've seen many examples of patients who've been given the inhaler and possibly it's been explained that this is how the medication worked, but nobody actually has shown them. And in one case, I had a lady who she actually failed to take the top off the inhaler device, and clearly, no matter how effectively she took the medication, it wasn't going to show any benefit or improvement. Patients have undue concerns with regard to side effects. So historically, patients with asthma have required to take prednisone by mouth, but in the last 20, 30 years, inhaled corticosteroids have been developed and they're extremely safe. So it's important for a patient with asthma to realize most patients with asthma take about 1/80th, so 1/80, the usual oral dose of prednisone when they inhale corticosteroids. And we and others have shown there's no risk of fracture, there's no risk of glaucoma, no risk of diabetes, osteoporosis with those low-dose inhaled corticosteroids. The vast majority of people can have their asthma well controlled if they take their medication regularly. And in fact, there have been many people who've won Olympic medals, elite athletes. So there's no reason for the vast majority of asthma patients not to lead a full and active life. Unfortunately, there's a small minority of patients who have very difficult to control asthma, who require higher doses of medication, have frequent exacerbations. But fortunately, that's a minority group of patients.